Welcome back to the Medi Gap show. I'm Holly Cohen, licensed agent and your host. And today we're delving into a topic that's incredibly important for retirees. Understanding the difference between original Medicare with a Medi Gap plan versus Medicare Advantage. Make sure you stay to the end to hear all the important information and hit that subscribe button and turn on the notification bell so that you're always up to date on all things Medicare. So if you're seeking expert guidance on your Medicare decisions, also you can head over to medigapcares.org or give us a call. All the links are provided in the description below. So now let's get started. Understanding original Medicare with a Medi Gap plan versus Medicare Advantage and what it means to retirees on group retiree coverage. Let's start with the basics. Retirees have two main paths for their health care. They have original Medicare with Medi Gap or a Medicare Advantage plan. Original Medicare, which is comprised of Part A hospital and Part B medical insurance, gives you the flexibility to stay on original Medicare and choose your own healthcare providers and hospitals because it's a no-network system. It only covers 80%, however, and that 20% coinsurance is where all the confusion comes in. But we're going to clear it up for you today. To bridge the gaps in original Medicare, we have Medi Gap, which is also known as a Medicare supplement plan. These plans are offered by insurance companies. They are standardized by Medicare. They fill in the gap of the 20% coinsurance of Part A hospital inpatient, and they fill in the gap of the 20% of your Part B outpatient. They also pay the Part A deductibles, and most plans you will have a Part B deductible, which this year equals $226 for the year. On the flip side, Medicare Advantage, also called Part C, bundles Part A, Part B, and often Part D prescription drug coverage into a single plan, provided by a private insurance company, and this does come at a high price. First of all, it takes you off of our original Medicare Part A and Part B, but you do still pay your Part B premium, that $164.90 a month, but you're no longer covered by original Medicare. These plans often do come with a lower monthly premium and sometimes not. Whether you're on an HMO or a PPO type of plan, there are restrictions to the network. Now that the foundation has been laid, let's talk about this article that has sparked our discussion. The article starts off about the New York City's plan that was to transition the 250,000 retired city employees from their existing original Medicare with Medi Gap over to a Medicare Advantage plan. Why was this causing such great concern? Let's dig deeper. Shifting to a Medicare Advantage plan may offer some savings to the employer or the city or the union, but retirees themselves are confined by narrower provider networks and potentially losing access to their trusted healthcare professionals that they've always depended on. Additionally, worries about prior authorization requirements and the limitations of these networks could create complications for the retirees. This transition would have been unsettling, to say the least. It was blocked permanently by the judge in New York City. So these retirees are currently allowed to remain on original Medicare. Now here's a critical piece of information that may not be widely known for retirees on group health care. You are able, if you're on a retiree plan, to come off any time of year, even if you've already started your group Medicare Advantage plan, and go back to original Medicare. However, if you want a Medi Gap plan, you may face the medical underwriting questions if you are outside your Medi Gap open enrollment period. This Medi Gap open enrollment period lasts for 6 months from the first day of the month It lasts for 6 months prior to your Part B effective date and continues for 5 months after. In this window, insurance companies providing Medi Gap plans cannot deny your coverage or raise any premiums based on your health status. So if you are in a group plan and you're beyond this period, health underwriting might be a factor in your state, and you may be either approved or declined coverage based on your health. So for retirees facing the prospect of transitioning from original Medicare and a Medi Gap plan to a Medicare Advantage plan, it's crucial to understand the implications. If the ability to retain healthcare autonomy and minimize unexpected costs are priorities to you, sticking with original Medicare and a Medi Gap plan might be the optimal route if you're able to do so. Now, let's take a deep dive into the article that has sparked this conversation today. The article starts off about the New York City's plan to shift the 250,000 retired city employees from traditional original Medicare to being forced onto a Medicare Advantage plan. This significant move, which is not happening, stirred up legal action and huge debate, and here's why. On August 10th, Judge Lyle Frank permanently blocked the implementation of a Medicare Advantage plan, though the New York City Mayor Eric Adams still plans to appeal the decision. This battle over a $15 billion contract, which would have been one of the largest of this insurance company's history, exemplifies a trend sweeping the nation for retirees on group plans. In 2022, half of employers who offered retirees health benefits do so through a Medicare Advantage plan, up from 26% in 2017, according to Kaiser Family Foundation. While more employers opt for Medicare Advantage plans for their groups, fewer are extending health care benefits even to their retired employees. The contrast is striking. In 1988, 66% of large firms provided health care to their retirees, compared to just 13% in 2022. The range of employers offering Medicare Advantage plans is diverse. Let's explore a few examples. IBM transitioned its retired employee benefit program to a Medicare Advantage plan at the start of this year, 2023. AT&T only provides their retired employees a Medicare Advantage plan now. American Airlines has altered its benefits program to its retired flight attendants, introducing a Medicare Advantage plan for them in 2021. California offers its state employees a choice between Medicare Advantage plans or Medicare or a Medicare supplement option. Illinois only offers Medicare Advantage plans to its retired state employees. Some retirees express concern about the potential limitations of the narrower networks and prior authorization requirements, which they are not subject to when they're on original Medicare with a Medi Gap plan. Some employers are hitting the pause button on this Medicare Advantage plan transition. For instance, Delaware suspended the implementation of a 3-year Medicare Advantage contract with an insurance company due to legal roadblocks. Similarly, the state of Washington postponed a potential Medicare Advantage plan for its retired state employees due to strong opposition from the retirees. Now that you have this comprehensive knowledge of the Medicare landscape and how it's affecting group retiree plans around the country, let's circle back to the retiree concerns surrounding the New York City situation. The shift from original Medicare and Medi Gap to a Medicare Advantage plan isn't merely about financial considerations. It's about preserving the freedom of choice and telling the truth to its retirees. Many of them who have worked for these companies or these cities or states for much of their career and were promised original Medicare with a Medicare supplement, also known as Medi Gap plan, in their retirement, which would have given them peace of mind knowing they are in charge of their own health care and not a for-profit insurance company who would rather satisfy their own stockholders than their Medicare Advantage plan members and their health care. And that's a wrap on our in-depth exploration of this dynamic between original Medicare with Medi Gap versus Medicare Advantage plans for group retiree coverage. If you found this breakdown enlightening, don't forget to give us a thumbs up and share this video with fellow retirees seeking clarity on their own Medicare situation and options. And remember, for personalized guidance, head over to medigapcares.org or always reach out to us via phone. Our team is here to assist you. Thanks for joining me today, and I'll catch up with you next time in the next episode of Medi Gap Show. For now, and as always, be well.